Okay, good morning, everybody. In the next 45 minutes, I'm going to talk about 12-lead electrocardiogram in the dog and give you some clue about when and how to use it. As you all know, an electrocardiogram starts from the depolarization of several cells within the heart, and these are then projected on the body surface area. And as you can see here, we have atrial activation wave. Then we have a conduction of the atrial activation through the atrioventricular node, and then you go into the ventricle, and then you have the QRS complex. What is very important when you look at the electrocardiogram is to consider the point of observation. And according to that, we really need to know the Cartesian planes. And as you can see from these pictures, you can see we really like when we study electrocardiogram in pets, we really like to put them just like humans. And so we want to have this type of position. As you can see, we have three different planes. The X plane is the frontal plane, the Z plane is the horizontal plane, and the Y plane is the sagittal plane. And you will see that this is very important because we observe the vector, the cardiac vectors, in a different way using different leads. So particularly for the lead system, we have the 6 lead system. The one that most of you is using right now is the Bailey's hexaxial system. It records the electrical activity on the frontal plane, here in pink. Then you have the precordial or chest lead system. In this case, we look at the electrical activity on the horizontal plane. This is in purple. And finally, we have the bipolar or orthogonal system that can be used when we record Holter, that it records electrical activity on the 3 planes. So this is come from our cover of our book, and you can see the heart, and you have now the frontal plane where you have the 6 lead system. So 1, 2, AVF, 3, and AVR and AVL. And then you have the horizontal plane, now is the precordial lead. We will talk a lot about it during this seminar about precordial and how to place it and how to interpret it. So let's start with the Bailey hexaxial lead system. So again, we look at the heart. This is a classical heart of the mesomorphic dog. And as you know, we use the position on the limb. And then you can see here all the leads around the esoaxial system. And it's important to understand exactly where we are looking, and particularly from AVL and 1 is the left of the heart. Here, down here is the inferior part is lead 2, AVF, and 3. We also call these lead inferior leads. Then we have AVR, that is the right side of the heart, and then the superior part is up here. Remember, in the dog, and we will talk about the anatomical differences in different morphotypes, but usually the left ventricle is placed inferiorly on the left, while the right ventricle is placed superiorly on the right. This is very important when we will look at on the 6 lead system. And then the atria, we have the right atrium, on top of the right atrium we have AVR, and on top of the left atrium we have AVL. And now let's see the different vector in the different planes. So this is the atrial depolarization. The atrial vector comes from right to left, superior to inferior. And so what you see is now in red is the P wave that is positive in inferior lead. Usually the more positive is lead 2. Then it's positive in AVF and in lead 3. The more negative is AVR because this vector is going away from AVR. It's a depolarizing vector. And then you have, it usually is positive or flat in lead 1, and again, positive or flat in lead AVL. Now, sorry. Now we have the ventricular vector. So the first is the septal ventricular vector. It's left to right, inferior to superior. So it's coming from the left ventricle up to the right ventricle. And this is inducing usually a Q wave in lead 2, AVF, and 3, and in an R wave in AVR. This is very important. And then usually is a tiny Q in lead 1, and usually also can have a tiny R or Q in lead AVL. Let's see now the other important vector of the left ventricle. The second vector is the right ventricular vector. The direction is identical to the first one, so it's left to right, inferior to superior. And it's concomitant to the third vector, the main important vector coming from that is depolarizing the left ventricle. And this has a direction right to left, superior to inferior. So it's coming from the up of the right ventricle down into the left ventricle. And what you see now, it's an R wave, very tall in lead 2, less tall, but still an R wave in AVF and in lead 3. Then you have a deep S wave in AVR. Usually lead 2 and lead AVR are specular for the main vector of the atria and the ventricle. Then it's either isodiphasic with a tiny R wave in lead 1, and then you can either have a negative or a positive wave in lead AVL, depending on the position of the heart on the frontal plane. Let's talk now about the precordial lead system. This is less used, but we think it's very important because the precordial lead system, now look at the vector on the horizontal plane. So how we need to orientate on the horizontal plane. So this is the area of the anterior part of the heart. Usually it's the right ventricle. Obviously here is cut, but you can see that the right ventricle is here, so is anteriorly, while the left ventricle is placed posteriorly. Then you have right and left. This is important. So remember, the left ventricle in the dog is posterior and inferior. The right ventricle is anterior and superior. And this is important when you look at the different Cartesian plane. In human, the most common system that has been used for decades is the Wilson system, and they put the lead from V1 to V6, V1 on the right, and from V2 to V6 on the left. And what it's important about the Wilson system for human, they have the first septal vector that usually induce a tiny R wave in lead 1. Remember, V1 is very similar to AVR because it's looking on a different Cartesian plane, but the morphology should be very similar to AVR. And then in human, we also have the tiny Q wave that is always the first vector in lead V5 and V6 usually. Then we have the second vector that is concomitant, that the right ventricular vector that is concomitant to the third one. And this third vector induced a deep S wave in lead V1, again, very similar to AVR, and usually an R wave from V2 to V6. The R wave become taller starting from V3 to V4, and then again smaller. What is important for human that the right ventricle reaches also the V2. You will see that is very different what will happen in dogs. And this sometimes you can have some S wave that is part of the vector that is going in this direction. So what is important, and then to remember that if V1 is placed in the right spot and there is no cardiac disease, the ratio R to S should be less than 1 in lead V1. and more than 1 from V2 to V6, meaning that you need to have a small r with a deep S in V1, similarly to AVR, and a very tall R wave with a very tiny S wave, so but the ratio should be more than 1 from V2 to V6.